Good morning from the Cedarville University newsroom, and welcome to FYI, a community affairs program of this station. I'm Marc Weinstein, Executive Director of Public Relations at Cedarville University, your host for today's program. I have a great program arranged for today, one that will impact everyone listening because it focuses on healthcare from a biblical perspective. And again, thanks for joining me today. Today in studio with me is Dr. Kim Higginbotham, Assistant Professor of Nursing, Dr. Marc Sweeney, Dean of the School of Pharmacy, and Luke Mennen, a third-year professional pharmacy student, all from Cedarville University. And for those listening who are not aware of the rigorous pharmacy program at Cedarville, it's a 7-year program that leads to a Doctor of Pharmacy. So Luke has just one more year before he graduates. Let's spend a little bit of time right now getting to know each other, beginning with Dr. Higginbotham, who has taught at Cedarville University since 2000 and earned her Doctor of Nurse Practitioner degree from Vanderbilt University. Dr. Higginbotham, what is your specialty in nursing, in the nursing profession, and how did you get interested in this aspect?
Well, Mark, first of all, I want to say thank you for the opportunity to speak with you today. So I am a Cedarville alum, and I graduated from the undergraduate nursing program at Cedarville and had the opportunity to become a pediatric nurse practitioner from the University of Virginia.
So where are you originally from? And tell us a little bit more about your professional experience so we get to know you a little bit better.
So I grew up in the state of West Virginia, so Cedarville was close. And so, like I said before, I'm a Cedarville alum. And upon graduating from the program at Cedarville, my first position was at the Rehabilitation Institute of Chicago. Mm-hmm. And I had the opportunity to work as a nurse on a pediatric unit caring for children with spinal cord injuries, head injuries, gunshot wounds, children with special needs. So I loved and it was a privilege to care for families during their rehabilitation experience. After leaving Chicago, I moved to Charlottesville, Virginia, where I worked on an acute care nursing unit, pediatric unit, caring for children from respiratory conditions, infectious diseases, to children with cancer. And again, it was privileged to be able to care for patients and families at that time. And while I was working full-time as a pediatric nurse, I attended the University of Virginia and obtained my pediatric nurse practitioner degree.
Okay, so nursing is a special industry. It takes a special person. Is there anything in your childhood that led you to move in this profession, or what led you to nursing?
So my mother is a nurse,
okay.
And so of course I respected her decision and her profession, and really valued nursing and the model of nursing, which is really caring for patients holistically, physically, emotionally, spiritually. And the privilege it is to care for people is something that I personally admired from my mother and wanted to pursue myself.
Okay, so you mentioned that you were in pediatric primary care, which is great. Can you describe how a certification as a pediatric pharmacy care mental health specialist connects with being a pediatric nurse practitioner?
Sure. So my education and licensure is as a pediatric nurse practitioner, and I have had the opportunity to work with the underserved and vulnerable pediatric populations during my time as a pediatric nurse practitioner, and really identified the need of the mental health aspects of caring for the pediatric population. There is a huge need, and so I wanted to obtain more knowledge in that area so that I could care for those patients more effectively.
Oh, very good. Well, we'll get back to you in a little bit. Let's meet our other guest. Dr. Marc Sweeney, the Dean of the School of Pharmacy at Cedarville University, joins us today as well. Dr. Sweeney is credited with recruiting and hiring the entire faculty and staff for the School of Pharmacy and leading the program to its successful accreditation. So Dr. Sweeney, you have an education that blends pharmacy and theology. How does the theology component impact your pharmacy practice and career?
So Mark, again, thank you for the opportunity to talk with you today. We're in a unique position at Cedarville because Cedarville University very much focuses on integration of faith and the Bible into everything we do.
Right.
And so when Cedarville University decided to start a school of pharmacy, and again, having the background that I do, train both in ministry and also in pharmacy, what a great opportunity to come to Cedarville and help build a program that's founded on that blend, if you will. And from a personal standpoint, I have always found that my faith impacts everything I do. And the fact that I'm trained in ministry doesn't really impact me in terms of how I lived. I've always lived in terms of integrating all of God's principles into life, and that includes pharmacy. But as it pertains specifically to my pharmacy world and starting a school of pharmacy here, what we hope to do is essentially train up students, future pharmacists, to understand the value and impact they can have on people's lives, but also utilize healthcare as a mission field. It says in Romans chapter 6, it says, Christians need to compete with each other, giving honor. And if you think about that, if we're actually challenged to compete with each other in honoring those whom we serve, I mean, what a great foundation to build off of in terms of serving people in the healthcare arena.
That's great. You mentioned about the founding of the School of Pharmacy. When was the School of Pharmacy founded? And can you share an example or a situation where you've overcome something that's led to great success for the School of Pharmacy?
So when we started the School of Pharmacy, we did that back in 2009, and that was during a time where there were a number of colleges of pharmacy across the United States. In fact, a lot of new schools began to be developed between 2000 and 2012, and so we were one of several schools. And when the accreditation team came to visit Cedarville, one of their first statements to me was, we really don't need another college of pharmacy. Mm-hmm. They basically just flat out told me that. However, they said what we really need is a different college of pharmacy. And what they meant by that is a college of pharmacy that operates philosophically different than the others. And what the victory or success that God handed us was at the end of the very first formal visit, the accreditation team leader who told me that earlier in discussions, he said, well, you've accomplished it. You have started something that is different than what everyone else is doing. And so we were just really blessed by the fact that they captured a vision of what we were trying to accomplish.
So that difference is the faith component. So is Cedarville the only Christian college in Ohio or the country that has pharmacy?
So as you might know, I mean, how you define a Christian college can vary, from university to university. So what I would argue is that we are certainly a unique college of pharmacy from the standpoint that we recruit Christian students to a group of Christian faculty and staff, and we seek to serve the world. I would say that is what makes us unique.
That's great. And quickly, I read your bio and noticed that you're involved in a lot of outside pharmacy organizations, the Ohio Pharmacists Association, etc. How does being part of these organizations help you lead the School of Pharmacy?
I've always believed that decisions are constantly being made across the United States in political circles and within our legislator circles, within our professional circles. And I've always believed it's better to be at the table to shape the decision before it's made rather than to react to the decision after it's made. And as a Christian, I'm much better positioned to have a bigger influence if I'm shaping the future rather than reacting to it.
Right. That's very good. Let's move on to our third guest. We'll get back to you again later, Dr. Sweeney. But our third guest is Luke Mennen, the third-year professional pharmacy student. Luke, tell us where you're from and what motivated you to pursue a degree in pharmacy.
Thanks again for having me.
You're welcome.
And I'm from Carmel, Indiana, which is a little north Indianapolis,
right,
about 2.5 hours south of Cedarville. And with pharmacy, it was something that just started off as I just wanted to pursue something to help others. And it ended up that led me to healthcare and being able to see all of the opportunities that I could have within pharmacy, whether that be retail, such as CVS or Walgreens or Kroger, hospital, even just insurance companies or any other pharmacy company that I could work with was just attracted to me, and knowing that there's so many different opportunities And the more that I have learned about the profession, the more I'm getting to know that we can really make a positive impact on our healthcare system.
That's neat to hear. You have one more year, roughly, maybe a year and a half, of your pharmacy studies. So what, from your pharmacy studies and work in the School of Pharmacy, has inspired you to excel in the classroom?
I truly believe that Cedarville's School of Pharmacy is a very unique just institution. The way that we are just taught to learn is we're told to self-learn, and then from that, we work in collaborative groups to accomplish our tasks that we have in class. And then after that, we apply that application through personal cases that are real life and that our professors have seen in their practice. And being able to go through those cases and seeing that we are working through stuff that we're going to see in our future, it really just hits home to me and our students. And being able to just see that we're not just learning from a textbook, but we're learning from real life situations that we're going to see in our future. And it really just encourages me to learn and excel in the program.
Neat. We're going to get more into your story in a little bit. For those listening to us today, you're listening to FYI, and I'm talking with Dr. Kim Higginbotham, Dr. Marc Sweeney, and Luke Mennen about some very exciting healthcare initiatives that are being planned right now at Cedarville University. If you didn't know it before today's program, you'll soon learn that October is National Pharmacist Month. And Luke, who's the pharmacy student from Cedarville, is here to talk about that special event. So Luke, what is National Pharmacist Month?
It's a great question. This month is dedicated where pharmacists and student pharmacists across the nation are advocating for pharmacists and the achievements that they've made, while also educating patients and healthcare professionals and policymakers about how integral we can make the role that we can have in healthcare system.
So what is the School of Pharmacy at Cedarville doing to promote National Pharmacist Month?
We are taking this and using it through specific events as well as social media. So with social media, we are making weekly posts about what exactly pharmacists can do to help our community through the roles that a lot of people are not aware of. So most people think that that we just count the pills and make sure that everything is good, but just making sure that, hey, we can actually help with making sure that there's no interaction through medications and helping patients just find ways to successfully manage their medications. Yeah. And through our events, we have one that's at One Bistro, that's in Xenia. And through that, we are going out into the community and we are taking blood pressure and blood glucose from patients and telling them exactly what that means and how we can better manage certain disease states while also administering free flu shots. So
when is this event at One Bistro in downtown Xenia?
So this will be on October 24th, and that's from 5 to 7. And it's just a great opportunity for people to come and learn about what pharmacists are doing and also to get immunized.
Is there a cost? Do people need to register?
It's free of charge.
Okay.
So, and that same night, let's say you don't live in Xenia, we are also having an event in Kettering. So at LifePoint Church, we are having a group of student pharmacists go and speak about prescription drug abuse. And this is directly to middle school and high school students. And just being able to talk about some topics that are hard for parents to discuss, but having students that are aware of medications and what pharmacists can do to reach out to students and be able to just go through that. We've seen positive results with that in the past, and we hope to see that. And that would be October 24th, and that will be from 5:30 to 6:30.
So people are driving in their cars right now and they're listening to this. Can they go to the Cedarville website to learn any more about this, or just write a quick note down while you hear this? What's the best way for them to remember this or learn more?
Best thing is to look up on Cedarville's website through their pharmacy program, or through Facebook. If you go through Facebook, that's a popular social media that our chapter has. It'd be through APHA-ASP, and there's a lot of events and social media about that. And that's where we're also posting the social media events.
Very good. Thanks for sharing that. And I'll get back with you later in the program as well.
Thank you.
So you're listening to FYI, a community affairs program of this station. And today I'm talking with Luke Mennen, a third-year pharmacy student from Cedarville University. Dr. Kim Kim Higginbotham, Assistant Professor of Nursing, and Dr. Marc Sweeney, Dean of the School of Pharmacy, all from Cedarville University. So let's transition from National Pharmacist Month to a campaign that all of our listeners can support, or even should support. It's called Shoes for the Shoeless, and it officially began this past Thursday, and it continues through February. And that's what Dr. Kim Higginbotham is going to talk about coming up now. So Dr. Higginbotham, this is a real big initiative, and you're partnering with an organization to do this. What's driving this from the School of Nursing to participate in such an initiative?
So every year, Dr. Mickle, the Dean of the School of Nursing, casts a vision for the faculty, staff, and students in the School of Nursing. And this year, her vision was love never fails, from 1 Corinthians 13. And so the idea of Shoes for the Shoeless, she was contacted regarding that opportunity, and the School of Nursing Executive Committee felt like it was a perfect opportunity to really engage in love and action and to be involved in this organization.
Okay, so as our listeners are driving or they're home, getting ready for church or whatever they're doing, and they're listening to this program, they need to hear this data that I did some research and learned that nearly 41% of children in Montgomery County live in poverty and lack properly fitted gym shoes. How will this campaign, Dr. Higginbotham, which is focusing on students right now for you guys in the Springfield area, how will your campaign help reduce this high number of students without proper footwear?
So we know that in the state of Ohio and in our very local community, there is a significant rate of poverty. In Springfield, there is a rate of 27%. And we also know that nationally, about 42.9%, or almost half of children in the United States, live in or around the level of poverty.
Wow.
Poverty has been linked to adverse outcomes, physical outcomes, cognitive, behavioral outcomes. And poverty is a source of toxic stress. So when we think about any opportunity to mitigate that toxic stress or those adverse outcomes, Shoes for the Shoeless was organized in 2010 by Chris Horlacher. She's the executive director. And she is a registered nurse and identified a need in the community and was compelled into action. So when I think about the definition of compassion, I really feel like that is a true definition of compassion, to engage, to discern a need, and then be compelled into action.
Yeah, I have to admit, as I'm listening to you talk about Shoes for the Shoeless, Luke talking about the National Pharmacist Month, and Dr. Sweeney, and just what the pharmacy school is doing, I'm just inspired by really what you just said, that the heart of compassion is really permeates the healthcare programs here at Cedarville University.
Mm-hmm.
Now, I realize that I am a little biased, but from what I see, that's a theme, a thread, and that solely comes from Christ. So I commend you guys for what you're doing in your respective areas. So again, if you're just joining us, you're listening to FYI, and I'm talking with Dr. Kim Higginbotham from Cedarville University School of Nursing about Shoes for the Shoeless campaign. Dr. Higginbotham, what are some real tangible results from a physical and a spiritual perspective that you hope to see come from the Shoes for the Shoeless campaign?
So as I mentioned before, Shoes for the Shoeless is a faith-based organization that its main purpose is to meet the basic needs, such as properly fitting shoes. Their mission is really compelled by meeting the needs of the poor. And so this is an opportunity to really meet very basic needs in our community.
Why did you zero in on Springfield?
So the contact information that Dean Mickle received was an initiative within the Springfield area. So there's a number of local elementary schools that will be participating in Shoes for the Shoeless.
Okay, so you're scheduled to visit 10 elementary schools in Springfield during the campaign. Can people bring shoes to Cedarville University School of Nursing? Can they send checks? And if they send checks, who do they make them out to? How can people who are listening to this program this morning participate?
So one of the things I would recommend is getting on their website, Shoes for the Shoeless, and on the website there are links that will help people identify ways to donate and also ways to volunteer. So we are certainly willing to, if people want to donate gym shoes for elementary school age children, we are happy to facilitate getting those to Shoes for the Shoeless. But I think getting on the website and following those links really are the best way to get connected and to see what other opportunities are available for service.
Is it purely gym shoes that you're looking for?
Gym shoes and socks.
And socks, okay.
Yes.
So great. Thanks for sharing this great initiative with our listeners. And I encourage you, listeners, to participate in this worthwhile campaign. It's easy to take our needs for granted because we live really in a wealthy area, society. But not everyone has the financial resources to put properly fitted shoes and socks on their children's feet. So will you help? Check out the website, as Dr. Higginbotham has mentioned. So as we now transition to our final segment on this FY program, I want to turn our attention back to the world of pharmacy with a conversation with Dr. Marc Sweeney, Dean of the School of Pharmacy at Cedarville University. We hear a lot in the news today about the growing opioid crisis in Dayton and southwestern Ohio, across the country. But for today's conversation, I'd like to focus on a promising initiative by your school. And that, if you didn't know about it, listeners, Cedarville University will soon open the Cedar Care Village Pharmacy, which will be a teaching pharmacy in the village of Cedarville. And the purpose of this pharmacy, I understand, is to provide excellent care for residents with their prescription needs. So Dr. Sweeney, with that as a backdrop, why did Cedarville University believe this was an important project to pursue?
Sure. So certainly Cedarville Village is a small community, and it's where the university is. But last year, the local pharmacy here in Cedarville closed, and it left the community basically without a pharmacy. And even though we're a good 15 minutes from the next pharmacy, we recognized, to provide best care in this village to the people who live here is to serve them well within the community. And so we, as a university, rallied behind the need and essentially decided to launch a local village pharmacy. It is a teaching pharmacy, which simply means that our students and our faculty will be involved with a lot of the programming that goes on there. We'll be training students on how to be best practice pharmacists, but we'll also use it not only to teach our students, but to teach the community. This pharmacy will host multiple educational initiatives and events and screenings, and we hope to basically educate the community at large about all of the opportunities that people have to take ownership of their own health care.
That's a great initiative. So as your students work in the pharmacy, obviously they're helping themselves educationally. Is the teaching pharmacy concept something unique to Cedar Care Village Pharmacy, or is that a trend in Ohio or nationally?
So in every pharmacy, there's some degree of education. When we send our students out to train, regardless of what pharmacy, health system, physician office, what clinic, what long-term care facility, our students train in all types of healthcare environments. And all of them take an ownership of education in some fashion of our students. But in this particular case, it's unique in the sense that the university is very, very closely tied, and the School of Pharmacy is very closely tied to piloting best practices and innovation in such a way to prompt our students to be inspired to be innovative in their own practices as they graduate.
And so, as I think about this teaching pharmacy, and I put myself in the place of a parent or a high school student, and I have to think, if I want to study pharmacy, I can study pharmacy at 6 or 7 schools in the state of Ohio if I wanted to. But this seems to be a niche that sets your program apart. Is that a fair assessment?
I would say so. So it is a niche in the way that we are accomplishing that. So we're looking at we've combined our Center for Pharmacy Innovation, which is in the School of Pharmacy, with the initiatives of Cedar Care Village Pharmacy. And so even though other schools would offer some training in pharmacies that they may be affiliated with, or in some cases that they even have on their campus, this is unique in the sense that we are actually going to implement pilot programs that, for all practical purposes, will be very innovative. Yeah. So you mentioned the opioid crisis as a starting point. Right. We hope to be able to pilot some strategies and educational initiatives within this pharmacy to help just improve awareness and address some of the challenges of that crisis. Mm-hmm. And we do it as a team. I'm a big believer that we can accomplish a lot more as a team. In this particular setting, we're collaborating not only between the community, but between the university and the school and the local village pharmacy.
Okay. If you're just joining us, you're listening to FYI, a community affairs program of the station. I'm currently talking with Dr. Marc Sweeney, Dean of the School of Pharmacy at Cedarville University, and about the teaching pharmacy that will open in the village of Cedarville. Dr. Sweeney, in addition to students working in the pharmacy with a licensed pharmacist, is there anything else that will be unique about Cedar Care Village Pharmacy that our listeners want to hear about?
So one of the niches that we hope to accomplish with this pharmacy is we recognize we happen to live in a community that and surrounded by a lot of other small communities with a lot of student athletes. And we have recognized that the student athlete has a lot of unique needs. And so we hope to partner with all the sports teams, the coaches, the athletic trainers for colleges, and with high schools and middle schools, so that if you have a need for your athlete, whether it be specific education, specific medical equipment, or particular wraps, we're going to make sure that we carry all of that, all of those products and those product lines within our pharmacy. Additionally, we're a big advocate of health and wellness. So we're going to carry products that advocate for best health. And so that's what we hope to do, is really be a community partner with all the local sports teams as one of our initiatives.
Okay. So we have about a minute or two left. Where will the pharmacy be located, and when do you anticipate it being open to the public?
So the pharmacy is actually right downtown Cedarville. It is actually on the corner of Route 72 and 42. We purchased the old Cedarville hardware store that's been really an icon of the community for years. And we've purchased that, and we're renovating that currently with the hopes of opening January of 2019.
Okay, that sounds exciting. Luke, so you hear all this good news about this teaching pharmacy. I assume that you're going to probably benefit from that. What excites you about this teaching pharmacy that's going to open in January?
I think it's just amazing that students can leave the lecture hall and go into an environment that really fosters just students just improving as patient care providers and being able to work with real life patients and help manage their medications. And I just see it also as all of these ideas of innovation are starting just to encourage the future pharmacists of America just to start thinking creatively to figure out ways to improve our healthcare system.
Fabulous. From this program, I say the future is bright in healthcare, because the type of students you got to produce here at Cedarville University in nursing and in pharmacy seem outstanding. And the people who are listening to this show should be excited and encouraged that healthcare will be strong with these graduates. So thanks for joining us today. That's today's program, which came to you from the Cedarville University newsroom. I want to thank my guest, Dr. Kim Higginbotham, Assistant Professor of Nursing, Dr. Marc Sweeney, Dean of the School of Pharmacy at Cedarville University, and Luke Mennen, a third-year pharmacy student, for joining me today. I also want to thank you, the listener, for spending the past several minutes with us. Please join me next month when I will have guests who will discuss other topics of current events from a biblical perspective. And finally, I want to thank Cedarville University for the use of this fabulous newsroom. As you know, Cedarville teaches all of its students academic programs from a biblical worldview. Whether it's pharmacy, cybersecurity, engineering, biblical studies, or nursing, Cedarville University is a place where you can get a quality education. And Cedarville is located in southwestern Ohio between Columbus and Dayton, and has a student enrollment of 4,200 undergraduate, graduate, and online students. I encourage you to check out Cedarville by visiting cedarville.edu. That's cedarville.edu. Thanks for listening. Have a blessed day.